Hi, I am Navid Gaffarzadegan. I'm a faculty member at Virginia Tech. I'm reporting on a project that I have been doing about simulating the spread of COVID-19 in universities after they open. This is a simulation platform that can be used for what-if analysis. It's a first draft and still needs work. And the attention should be paid more to qualitative changes in values rather than quantitative estimations. So this is the basic structure of the model that follows SEIR models. We have susceptible, we have exposed, and then infected individuals are in two groups of the ones that we find by testing and the ones that we can't find. This model is formulated using differential equations, and I have used Vensim platform for simulation. This is a dashboard of my simulation model. And when I run it for the base run, then there I have only few policies in place, such as test at level of 500 capacity for my test per day, and quarantine capacity at 170. If I run the model in that condition, I see that the disease spreads very fast, and actually in about a month, it can infect the majority of people in this population. I'm assuming that we have 25,000 students and about 3,000 staff in this hypothetical university. So what happens is that the disease spreads very fast. We have maximum infected cases around 15,000. And the capacity that we need for quarantine will be way higher than what we have, and that's the green line, our capacity. And we will need way more than that. I'm showing the probability of having a case of death in this context, and actually the probability is very high. We reach almost the probability of 1 by 30 days, and that's shown by the blue line. The red line shows the probability of having at least 2 deaths. Green line, the probability of having at least 3 deaths, and dashed line, the probability of having at least 5 deaths. I have separated them for students versus staff and faculty. And as you see, for students, the probability of having a death is a little bit lower or slower growth in the probability, and that's because of the age category. I have parameters about different scenarios that I can test in this model. That includes quality of the test that we are using and capacity, and the characteristics of the disease. Also, the rate at which students are entering the university. We have parameters for testing. I can test different testing policies, mask enforcement, quarantine, stay-at-home policies, and early self-isolation policies, or any combination of these. Of course, this is the worst case scenario, and it is unrealistic. And I think in the real world, what will happen is that the university will shut down way sooner than this catastrophic event happens. We have a threshold for closing the university based on active cases in this simulation. Let me put that at 1,000, which is a relatively big threshold, but kind of shows how the results can change. If we close the university when we have found 1,000 cases, our total cases reaches 6,000. Our actual active cases reaches almost 5,000, where we are only finding 1,000 of that. And that's around our threshold for closing. The capacity that we need for quarantine will be way higher than what we have. And the probability of death still is high. But you see that the model, the simulation, shuts down the university around time 20 or so by showing this blue line, which goes up. That's when the university is closed in this model. So let's test different policies. The first thing I want to do is more frequent and quality screening or test. So if I increase that by an order of 5 and increase proactive screening until the end of the simulation, and if I increase testing capacity to 1,000, that helps. As you see, our total cases are declining to less than 6,000. But still, the university has to close as we are reaching 1,000 active cases, and that's where the simulation model shuts down the university. But the major issue that testing is not helping much here is that we assume test delay is 3 days. That's the time between symptom onset and us finding diagnosing an infected individual. If we decrease that to 2 days, that helps. 1 day further helps. As you see, as I'm changing this, what is happening is that my graphs are kind of slowing down. They're shifting to right. And the time for closure of the university is also moving toward right. Let's say that we can do that successfully at 1.5 days. And that helps a little bit, but still is not enough. And still we are facing a huge risk of having death cases. If we can enforce mask adoption at, say, 70%, that further helps. That decreases the cases. It decreases active cases that we had, and further decreases the chance of having death. As you see, the university is now closing about time 50. Another policy that we can check is about the capacity of quarantine. You see in this graph that we have this green line which shows the capacity, our current capacity for quarantine. I'm going to raise that capacity and see what happens. If we can raise that, say, to an unrealistic number of 1,000, that really helps. That means that for any individual, infected individual, we are able to find 4 people that has been in close contact and quarantine them. That helps flatten the curve. But probably that's unrealistic, and we can do it like mostly, at best around 500 cases. If we do quarantine at 500, as you see, the cases are declining. And the last policy that we can test is enforcing or encouraging strongly people who are over 60 to stay at home and do everything remotely. If we can do that policy by 80% performance, you see that graphs are declining, the chance of having death is declining significantly. If we can enforce people who are in the age category of 30 to 60 days, also encourage them to stay at home. If we can do that by 60% of the population, that also further helps both decrease the probability of death for faculty, staff, and the probability of death for students, because the whole infection slows down. So this is a combination of policies that we did, and if we look at what has happened, we see that number of cases are ending around 7,000 total cases, and maximum active cases reaches about 2,200. The university still closes a little bit earlier than usual, and that's because we passed the threshold for closing the school. Now, let's test the policy that we encourage self-isolation during the first 3 weeks. Assume we have passed that threshold to implement that policy, but that would have been also a useful policy to further decrease the cases. But probably that's not any feasible now. So this is what the model shows. Obviously, the best thing that we can do is to decrease number of students in the university. Currently is assumed is 25,000. If we could have brought only 1/4 of the population, just let's say only a freshman or only junior, right? That could decrease the cases, decrease the probability of death, and would be very helpful. If you can keep everyone stay at home, obviously that would be way more helpful, but smaller numbers would be still helpful. So this is a platform that different policies can be tested for closing the university. As we observe that this probability of death is high, probably we are going to pick numbers that will kind of lead us to earlier closure, just to make sure that having any case of death is not likely. There are different parameters that we can change in this model. One is that total active cases that we have, or daily cases that we are getting, and a moving average of that is calculated, and we can set a threshold for closing the university based on moving average of cases, daily cases. We also have a threshold for death, probability of death, and we can turn that on and ask the model to shut it sooner if the risks are increasing. So this is the model, and it is formulated using differential equations, and it can represent a wide range of contexts. Still, no specific data from any university is used in this model other than kind of a general distribution of students. Parameters of the model are used from the literature, which are for different contexts, like different countries, and they're not for any specific university or any context that are related to education. But as we open the universities and we receive more data, different parameters in this model can be further calibrated to inform decision makers in different universities. For example, this R naught, I'm assuming it is at 3. Some people may argue that it would be higher as university students are more active and more socially are more active. And some people may say that it is lower because now everybody is careful and they're decreasing the level of activities that they may have. We don't know what that be, and that's one of the parameters that can change from the outside. Overall, this platform can be used to test different policies. I still want to stress that numbers don't mean much in this context yet, unless we wait and further calibrate the model. It's more about kind of qualitative insights that one may get by comparing the strengths of different parameters and the overall change in the outcomes. Thank you for listening.